joining us to help choose home when care is needed. A podcast all about the benefits and value of receiving care in a place that you likely feel most comfortable, wherever you call home. I'm your host, Marilee Orsini, and I've been involved with healthcare at home since 1981. Each episode, I'll be talking with a guest who will help us in our quest to educate about healthcare at home. So let's get started. Today's episode is number 14, and our guest today is Dr. Stephen Landers. He's a certified family doctor and a geriatrician, and he's currently president and CEO of the Visiting Nurse Association Health Group, which serves Ohio and New Jersey. And it's actually the second largest non-for-profit home health care organization. Dr. Landers, however, has been involved in healthcare at home for a long time. I first met him when he was a practicing geriatrician with the Cleveland Clinic and was actively involved in getting physicians involved in care at home. So I think you'll enjoy this interview today. Let's welcome Dr. Landers. Steve, the first time I met you, you were winning an award from the National Association for Home Care and Hospice for your work at the Cleveland Clinic with physicians in home care. Can you talk to me a little bit about that?
Yeah, Marilee, thanks. I have been really lucky that I've, as a physician, it's pretty unusual, spent virtually my whole career in home care. So my first job, if you will, when I finished my family medicine training, it was to start a home visiting physician practice in my hometown of Cleveland, Ohio. And I really fell in love with the patients, with the people I was working with, and, discovered how incredible the world of home care was, and it's been kind of full speed ahead ever since then. And one of the neat things that happened to me, pretty early on in that work was some recognition by the home health agencies for the work that I was doing, which really just made me feel great and really added just a whole another level of energy for home care that I just am so thankful for.
So as a physician, and I will agree that is unusual, your trajectory to get where you are today, what is it about home care and you that is specifically different than other physicians who have also interfaced with home care but have not become as passionate about it as you have?
Some things in life happen, I think, because of divine intervention, and I was not on track to be involved in home care, and one of my mentors and a great doctor was our department chair at the time, and he really felt that we weren't doing enough home care, that really nobody in the university medical group was focused on home care, and it had been a sort of a lost art. And he had the idea of sort of reinvigorating it and thought I would be the perfect person to go out and make it happen. And so because of his mentorship, I was able to get involved right from the start. And, just really from day one, just seeing how, what you learn about people when you take care of them in their home, how appreciative people are, particularly those with serious illness, and not just the people but their families are for the help, and the other people, the nurses and the aides and other folks in the community really I got to see their efforts, and it's just inspiring. And so it's been an incredible experience. And I over time, over the last 13 years, which has been the amount of time that I've been out of my training, I've gotten more and more involved in the business of home care and the administration of home care, which I love as well. So it's been a great thing to be a part of.
So that switch from being a practicing physician where you're actually dealing with the home care patient to running an organization whose whole focus is healthcare at home, what kinds of lessons are you teaching others that will help them appreciate the value and benefit of healthcare at home?
Well, I think that it's It's helpful for home care to have physician advocates and to have physicians that can help tell the story. Um, I, I think that for not really any really good reasons, home care has been a bit out of sight and out of mind in American medicine. Just we got so focused on the four walls of the hospital, and as physicians we become specialized in one narrow part of the body or one wing of the hospital, and there's been a bit of I think a miss in terms of recognizing how important healthcare at home is and can be. And so I think just, being able to tell that story from a physician standpoint, help people see how and where it fits in. The discussion's definitely changed in the last, 5 or so years than it was in my initial work in home care. I think that the pendulum has swung because of health reform, because of the aging of the boomers, because of, payment realities and technology. There certainly now is more of a sense that home care is futuristic and is a part of the new world, if you will, in healthcare. And so I think that's changing. I think that there's a lot of teaching that needs to happen on what's possible. There has been an incredible amount of innovation, experimentation, demonstration projects, pilot projects, entrepreneurial initiatives in home care that are not well known. So, I think that just being able to bring those up, let folks know that, there has been a lot of experience with things like post-surgical home rehabilitation as an alternative to facility care, or home infusion as an alternative to hospital or facility care, hospital at home approaches, innovative ways to do palliative care at home, and bridging or transitional care models and palliative care approaches. So I think that's helpful to help bring that to light and bring new people to the conversation.
If you were asked to tell consumers, how could they talk with their physician if they're feeling resistance? And let's take a discharge from a hospital as a for instance. So the patient is getting ready to be discharged and the family is looking for what happens next. How can a family talk to a physician if they're feeling reticence to come home? Are there words of wisdom or resources or something that you would consult with the family and tell them how they could make that happen?
Sure. I think for one, in a crisis mode, it's always difficult. And, when decisions, have to be made in a real urgent situation, it's very hard. I always recommend people to plan ahead if you want to be able to age in place at home or remain at home. And that planning really involves everything from thinking about the home, your home environment. Do you have accessibility to a bathroom, and where are the stairs, and how are you going to get in and out of the home if you're having trouble walking, and so that type of stuff. To also just, if you're confused or need help with healthcare decisions, who will be your advocate or decision maker, or power of attorney. So having those healthcare documents in order, and making sure that the people that you are going to rely on know what you want and know how important it is that you be at home, even if that means, there's some trade-offs in terms of the risks and benefits. So making your wishes known is really important. Remembering that Medicare really only pays for a small part of home care, only certain types of home care. And so, to be at home where you might need extensive home health aid or personal care services, you might need to finance some of that yourself. So there's financial planning that people need to think about. So I really do encourage people that really want to be sure they can go home from the hospital on a bad day or a bad week, that they've planned ahead. In the moment, I think that there are things that you can do, like, just bring up that, make sure people know that you want to be home and that your family's on board and they're willing to step up and help out if need be. I think that, in a lot of hospitals, there are geriatric medicine specialists and there are palliative medicine specialists. And I think if there's some controversy or disagreement about going home, I think asking for a geriatric doctor consult or a palliative doctor consult might be a good idea, because I think those specialties are particularly good at paying attention to the person's goals, even if those are different from what maybe the primary treating doctor's goals are.
When you have serviced patients at home and you've done home visits, how can you find a doctor to do home visits today? Is that something that's happening more often?
There are doctors and certainly nurse practitioners that work with doctors doing home care. It's not available easily everywhere, but it is available in a lot of places. I would recommend asking one. You could ask your local home health agency if they are aware of any local doctors doing home visiting, because there's a lot of overlap between people that need home health agency or visiting nurse care and doctors at home. So that's one place to check. And then another thing to look into would be an organization called the American Academy of Home Care Medicine, or AAHCM. That group is the professional society for doctors that make home visits, and they have a directory.
So the resources are available if someone knows where to go look and then goes to look for them.
In many places. I don't want to say that it's available everywhere, because it is not in every single community, but certainly in certain pockets in every state in the country, there are home visiting physicians.
I'm going to switch gears a little bit and talk about your current job, because you currently are head of the second largest nonprofit home health organization in America. And congratulations, by the way. I think we need your caliber of leadership, and I'm anxiously awaiting all the things I see you doing. As a business person and running a home care agency, what would you tell consumers in terms of what they need to know about a loved one who might need care?
Well, I think that it's important for the public, everyone, to know that there is an incredible resource in our communities, in our country, in the home health agencies. These are really just incredible companies that have really talented people: nurses, physical therapists, occupational therapists, social workers, home health aides, and personal care workers. These are really incredible resources, and because they don't have a big building, or an ivory tower, they might get overlooked. But there are agencies in virtually every community in the country, and by and large, they are an incredible resource. So I think people should know that they're around and should become more familiar with the agencies in their community. On the nonprofit side, we always enjoy having people involved as volunteers and helping with philanthropic activities that seek to serve people that otherwise might not be able to afford the services. So I think that those are all things for people to be aware of. I also, can't emphasize enough that for people to age in place at home, it requires planning. These are hard topics. Nobody wants to talk about it on a good day, We don't like confronting that maybe one day we might not be able to care for ourselves without help, or might not be able to, do all the things that we want to do. And I just have seen over and over again as an administrator or CEO and as a clinical direct service providing physician that planning and thinking about these things ahead are really, really important. So, I can't emphasize those points enough around everything from preparing the home to thinking about goals and advanced directives and powers of attorney, and also thinking about the financing of care at home. These are all really, really important things to think through and have discussions about with loved ones. I think the AARP caregiver resources are helpful online. I think some of the long-term care insurance providers also have some good resources. I've seen good information from Genworth, for example. These are things families need to be thinking about ahead of time.
So it's not an intuitive thing. As soon as it happens, you just are automatically going to know what to do. You really do have to think about it, plan for it, research it.
I think that is where you see the best outcomes, where people really have done some planning. And I think the times when things don't go well and people, I've been on the other side of it, seen where people have had to, give up living at home. I've seen where adult protective services or sort of elder abuse prevention services have to get involved and sometimes get people out of their homes because it's so unsafe, because things weren't planned out. I think when people are able in some way to think ahead about the home structure, the entries and exits, where the bathrooms are, is there enough lighting? As we age, our vision and balance are not as good in many instances as they were when we're younger, and you don't want to be in a situation where you're going to be at risk for falling and breaking a hip or hitting your head, God forbid. So these things about the home need to be thought out. Sometimes planning a move is the right thing for people, and some type of downsizing or other move. And those aren't easy things to do in a crisis. They're hard enough to do when we think ahead, right? Moving is hard anytime, let alone if it's when you're on your worst day in the hospital and people are saying, you can't go back to your house. It's better having thought that through before the bad day.
Do you have any rule of thumb about how someone could know, have some premonition as to when that bad day is? I know it's a tough topic to bring up with parents, so I'm wondering, is there an opener, an icebreaker, something that happens that might open the door for that discussion with adult children of their aging parents?
Marilee, I think that the one reality is that virtually all of us in our lifespan, we don't just age, in great health and independence, and then, ride off into the sunset one day. The vast majority of people age and develop some type of chronic illness and some type of difficulty with the basics of life at some point. So it's not a unique or something that we can sort of think we'll avoid, right? It's basically universal part of the current human experience, is that at some point we're going to have some type of chronic illness, and maybe Dr. Oz will figure out what we can eat to prevent all that. But for now, it seems like if it doesn't hit you in your 70s or 80s, Father Time seems to catch up, in the 90s. So I would say certainly, if anybody has a chronic illness-related hospitalization, a chronic illness like, heart failure or diabetes or high blood pressure ends you up in the hospital for more than a day or two, that would certainly be time to have a discussion, because you might be at risk for something like that happening again. Anybody who's having trouble with the basics, like getting around, where they've fallen down at home, or struggle with mobility and need help moving around, I think that's an important trigger. It may be too late in some of those cases if it's a real crisis. I mean, the classic crisis is somebody falls and breaks their hip, and then that really changes a lot of times their ability to function at home after that. I think that the birthdays, holidays are times to maybe after the celebration or before, just to reflect on what's next. Getting the help of again, some of those doctors and nurses that are good at these discussions, I think, can be helpful. In some places, there are what we call geriatric assessment programs in some communities, where geriatric medicine or elder care physicians do special evaluations. We call them comprehensive geriatric assessment. That can lead to a discussion. For some people that have the means, there are occupational therapists on the private pay market that will sometimes offer to help people think about home structure or home redesign if they need to make a bathroom or entryways more accessible. I hope some of that helps.
Very, very helpful. Again, I think in my training and my education and experience, what I've learned is people don't even think about it until a crisis occurs. So this whole idea of trying to get consumers to plan, to plan for some sort of care and to think about realistically what their situation is. I could talk to you forever. You always add things that I learn things from you, and I could just listen to you forever. So we're going to come to a close here, though. So is there something that I haven't asked you that you really wanted to talk about today, or something you would like to leave our audience with as a closing reminder or thought?
Marilee, thanks so much for the chance to speak with you. And I would just say that the most important thing that I've learned about home care is that it's really all about people taking care of other people. And those people providing the care, particularly the nurses and the aides and the rest of the team, these are such special people. I mean, this is not easy work. They really navigate a lot of discomforts with the driving and the weather and going into all sorts of types of homes. It really requires a special humility and a special personality, and they are just really the hidden angels of the healthcare system. We need to make sure that we're able to provide them with opportunities to learn and grow in their career. We need to train more people intentionally to get into home care, rather than just wait for people to work in the hospital for a couple years and get burnt out and decide they need a change. We need training programs and career development programs for the people in home care, because they make such a difference. And if there's one thing that I think will help more and more people be able to remain healthy and independent at home in the future, it's going to be having a stronger, better supported home care workforce. That's a real big deal.
Thank you so much for listening today, and a special thanks to our sponsors and partners, Access, National Association for Home Care, and Hospice and Core Cubed. You can find more on our website, helpchoosehome.com, and on social media. Join us, want you to spread the word and help choose home when care is needed.